When we talk about children with overweight or obesity, or anybody in fact with overweight and obesity, it's not about body shaming, because everybody of any size has value. But we do want to focus on the fact that children who are overweight and or obese, they do have an increased risk of diseases like type 2 diabetes, even in childhood. And also, children that are overweight or obese are more likely to be overweight or obese as an adult, which will increase their lifelong risk of type 2 diabetes, heart disease, even certain cancers. Children with overweight and obesity tend to have a low intake of fruits and vegetables. They also tend to have a higher intake of prepackaged or ready-made processed foods. They tend to also consume sugar-sweetened food or beverage items like regular soda, cookies, cakes, candies. They also tend to live in rural areas where they have what we call a food desert. That means there's limited access to grocery stores that have adequate supply of fresh foods at a reasonable price. Statistically, according to the CDC, children that come from homes where they have a lower income will also have a higher incidence of overweight and obesity. Sometimes we actually see that children have late bedtimes, sometimes even going to bed after the adults in their home, and so then that contributes to unknown food intake. So, there's so many suggestions for healthy eating for children, and one is make healthy eating a priority. So what that means is learning about healthy eating if you don't already know yourself, learning what that is, and then making a plan to do your best to offer healthy eating options to children. Include your children or your teens. Getting them involved is going to help them learn about healthy eating. It's going to help them learn about food preparation, and it's time spent together. And then healthy eating is really an investment in your child's lifelong health. Focus on eating whole foods as much as you can, as opposed to ready-made prepackaged food. So there's no doubt that healthy eating can be expensive, and it does take time. Some tips on that is before grocery shopping, take an inventory of what you have on hand. Then, if you have the opportunity to use the internet and go online to the grocery store you shop at and see what's on sale. Make a plan then based on the foods you have on hand, what's on sale, and plan some recipes that way. Make a shopping list, and then when you get to the store, stick to the shopping list. Plan to do some food prep at home. Plan some meatless meals once or twice a week. Instead of planning your meal around meat, which tends to be more expensive, plan your meals around legumes or lentils. They are lower cost than meat, and they're a good quality protein. Every avenue that we have available to us to use to address overweight and obesity in children, we need to use. We need to partner together to ensure that we are providing our communities with access to affordable fresh foods, that we have access to safe places to play, to exercise. Children spend their day at home, at school, at daycare, again, so it has to be a multifaceted approach. I would refer people to several websites if you would like more information on healthy eating, or if you have concerns about your child's weight. One would be myplate.gov, and your children are probably learning about MyPlate at school. So there's all kinds of resources for you there. One of those would be an app called Shop Simple. And that app offers you more budget saving planning tips, as well as budget friendly recipes. So that's one website. The other website would be We Can. And We Can is sponsored by the National Lung, Heart, and Blood Institute. And they have a large amount of information for parents on healthy eating that is focused more on children who do have weight problems. And another avenue really is, if you have concerns about your child's weight, talk to your child's healthcare provider. Your insurance may pay for individualized counseling with a dietitian who can address your specific concerns more pointedly.